Yesterday during our show, the House narrowly passed a Republican budget resolution that calls for $4.5 trillion in tax cuts, the bulk of that going to the richest folks, and a $2 trillion reduction in federal spending over the course of the decade. Now, it doesn't mention Medicaid by name, but it directs the House Energy and Commerce Committee to cut $880 billion from programs it oversees, which, let me tell you, cannot be achieved without slashing Medicaid. It's a program that provides health coverage to 72 million poor and disabled Americans. Simply put, they are going to cut taxes for really, really rich people like Elon Musk and others and corporations by cutting health care for the poorest and neediest people in the country. That's simple. It's a pretty politically dangerous approach for Republicans because, well, a lot of their voters are on Medicaid. In fact, in Kentucky, which Trump won by about 31%, over 1.4 million people are enrolled in Medicaid. That comes out to nearly a third of the state's population. Medicaid also covers care for 638,000 children, which is more than half of the children in the whole state. It is because of Medicaid that Kentucky is one of the lowest uninsured rates in the nation. Andy Beshear is the Democratic governor of Kentucky, and he joins me now. Governor, it's good to have you on the program. First, just as someone who is the governor of a state where there are a lot of folks on Medicaid that did vote for Donald Trump overwhelmingly in the presidential election, what would it mean for your state if we saw drastic cuts like what appear to be on the table?
It would be devastating, and it would be a betrayal. I mean, you think about the fact that the people we love most in life are our kids and our parents. Half of Kentucky's kids are covered by Medicaid, and 70% of long-term care costs in Kentucky are covered by Medicaid. Those are the people that we love the most and who are the most vulnerable, who would bear the burden of these cuts. It would also devastate rural health care. Rural hospitals will close around the country, and then our people will have to drive a couple hours to a big city just to see the same doctor or nurse that was laid off in their hometown because of cuts to Medicaid. It's a mistake. The American people will react and will react strongly, and I hope Congress doesn't go there.
You have managed to win election twice in a state that has gone for Republicans at the national level and the Senate seats. If you had a kind of referendum in the state of Kentucky, it's a counterfactual, but I trust you on this, to cut a bunch of Medicaid from the state, how do you think it would do in your state?
Well, I wish we had some referendums in our state, and it would fail, and it would fail significantly. Healthcare is a basic human right, and in Kentucky, we're getting healthier. We've had some real challenges in the past, from heart disease to lung cancer to diabetes, and we want the people that we love and care about to get the help that they need. But here's the other thing. Medicaid coverage works. Just look at our drug epidemic, where Kentucky and maybe West Virginia and Ohio got hit first and got hit hardest. Well, for the last 2 years, we've seen overdose deaths go down in Kentucky. And what recovery centers will say is when we started covering recovery and treatment in Medicaid, everything changed. Think about that. Those are people that are alive today, our brothers, sisters, friends, parents, and kids, because of the coverage that Medicaid provides. Or think about the economic impact. I talked about rural health care, but it's all of health care. We won't have the same number of doctors, nurses, orderlies, people working in hospitals. You won't have the number of options you have right now to go into the same-day clinics or the walk-in clinics. This will be more challenging for all of America that will bear the brunt of it, and everyone's access will be reduced because of it. I believe that at the end of the day, the things that the American people care about the most are their job and whether they make enough to support their family, the roads and bridges they drive on every day, the schools they drop their kids off at, the safety in their community, and their next doctor's appointment for themselves, their kids, or their parents. And this will complicate that significantly, make it harder on the American people, and ultimately, I think people will feel betrayed by having healthcare options taken away from them and making their life just tougher than it already is.